All right. Well, my name is Kirby Fye. I'm with the department. Welcome to the Region 1 Planning and Policy Council meeting, the first one of fiscal year 22. I can't believe it. Just a few things to go over. Per the Open Meetings Act, we're holding this meeting virtually. The council felt, excuse me, to keep everyone safe during these times, especially with the new variant going around. It would just be best to meet virtually again this quarter. We'll reassess next quarter and probably every quarter after that to see what's safest for everyone. So this meeting is being recorded. It will be posted to the department website within the next day or two. With that being said, please make sure your phone and or computer is muted if you're not speaking, just to prevent any feedback from coming through. And also, please state your name when presenting or asking any questions, as it's helpful in capturing the minutes. So like I said, my name is Kirby Fye. I'm going to go ahead and go through the attendance. I see we have quite a few callers. I'm going to go through the individuals who have joined via computer first. Then I'll go to the callers. I caught a few names as individuals were signing in, so I'll state the names of the individuals I heard that joined via phone, and then we'll go to those individuals that I didn't capture. So we have Amy Little, Avis Easley with the department, Becky Allen, Celeste Taylor, Frankie Nunley, Jason Abernathy, Katie McClellan, Kristen Veloff with the department. Melanie, what's your last name, Melanie?
Ison.
Can you state that again? I'm sorry.
It's all right. Ison, I-S-O-N.
Thank you, Melanie. Samantha Slagle, who's our vice chair for Region 1. And Zach Blair with the department. Let me see if I missed anyone else. Okay. These are the individuals that I heard when they signed in via phone. I heard Jeannie Price. I heard Christy Blaylock. I heard Vonda Wagner. And I heard Melissa Birdwell. If I didn't state your name, would you please, and you called in, would you please state your name for attendance purposes?
Wendy Ramsey.
Did you say, I heard Ramsey.
Wendy Ramsey.
Hi.
Hi.
The next person I heard. Pardon?
Tavia Philman.
Hi, welcome.
Thank you. Hi.
Anyone else?
Lynn Cook.
Hi, Lynn. Can you state your last name again?
Cook.
Oh, hi. Anyone else that joined via phone that I didn't state your name or you didn't say your name?
Kayla Withrow.
Oh, hi, Kayla. I had that written down too. Hi, Kayla. Anyone else? I think that might be it. All right, Sam, I'm going to hand it over to you.
Good morning, folks. Thanks for everybody making time on this Tuesday to meet with us and see what's going on in our corner of the state and our region. So I'd like to start out with an approval of last quarter's minutes. Can I get a motion to approve those? You should have those via email from Kirby.
Sam, this is Vonda. I'll make the motion.
Thank you, Vonda. Can I get a second, please?
This is Melissa. I'll second.
Thank you, Melissa Birdwell. I appreciate that. Okay. Some of our old business, we want to continue to remind folks. I think most of us may have gotten an email for our new fiscal year. I guess maybe an application. Kirby might want to correct me there, but we want to continue to make sure any new members get their documentation, their member enrollment, their member applications completed and documented, so they're really kind of accounted for and we know what's going on with any new members or for us in here in our region, we were trying to play catch up a little bit and make sure and get all of us that had been active. Maybe we didn't have the correct paperwork. So if you don't feel like you filled out any paperwork accordingly, maybe check with Kayla, myself, or Kirby. We'll figure out if you're certified or not. So we need to get all those applications completed as best we can. We always want to keep
Sam, this is
Yes,
Kayla.
ma'am.
I just wanted to throw it out there. If you have any question about membership, I do have a running list. So you can email me at kwithrow, that's KWITHROW @frontierhealth.org. And if you have any questions, just send it to me. And if we don't have you on there, I can get you the paperwork and get you updated.
Thank you so much, Kayla. Thank you for doing your secretary duties so well. We really appreciate you keeping up. It's kind of like herding cats, I imagine, at times. So thank you. Please email anybody, any of us. We'll get you to the right place. Should you not catch that email, we can get it for you as well. The needs assessment, we always want to kind of keep that on our minds. It'll be back at us again before we know it. So again, we're sort of in an odd year. COVID's still with us, and so I think maybe that changes things a little bit as far as when we look at our future, what our needs, what our current needs, what our future needs are. But please keep that in mind as we go throughout the year, so we're not kind of scurrying around trying to brainstorm when it gets to be time. We really have some stuff on the front of our minds that we've been really thinking about and continually, I guess, popping up for you as a need in our region. So just keep that on your mind, that we want to always sort of be working on our needs assessment, but we were able to get ours in for the last year, and we're rolling with that piece. And then, of course, we still have a workforce shortage. The issues are continuing really on all levels. In any employment situation, but especially in the mental health world, we're in a crisis situation, needing more staff, employees, workforce to really take care of the needs out there. So that's a continued focus. So our new business, Ms. Vonda Wagner and Christy Blaylock with Frontier Health, they cover our employment services and our intellectual disability service kind of continuum there. I think you ladies are with us. Do you by chance have something prepared to share with us? I'm not sure if you have a PowerPoint or anything of that nature, if you were just going to chat with us.
Hi, Sam. This is Vonda Wagner. Yes, we're just going to chat with you guys. Of course, we have tons of material, so if there is a need and you want to receive some information about our employment services, please do not hesitate to contact either me or Christy Blaylock via email. Our emails are vwagner, WAGNER, @frontierhealth.org, and Christy Blaylock is cblaylock, BLALOCK, @frontierhealth.org. But I'm just going to start out a little bit with some intro. I appreciate the invite and opportunity to discuss Frontier Health's employment services. I am Vonda Wagner. I'm the Director of Rehabilitation Services here at Frontier Health. And our rehabilitation services include quite a few different programs. Our psychosocial rehabilitation, peer support services, peer wellness coaching, the Communication Center for the Deaf and Hard of Hearing, and then the topic of our conversation today, employment services. Since 1989, Frontier Health has made a commitment to recovery through employment for all individuals. We currently provide kind of a gamut of employment services. Right now we have supported employment, both the traditional SE services for individuals with intellectual or developmental disabilities, and we also have individual placement support. You may have heard by IPS that's more targeting towards people with mental health concerns. We have a Ticket to Work, Healthy Transitions program, and the SSA demonstration project. So to tell you a bit more about these services, I've asked Christy Blaylock, our Employment Services Coordinator here at Frontier Health, to join me. Christy, the floor is yours.
Thanks, Vonda. So as she said, I'm the Employment Services Coordinator, and I work primarily with the Individual Placement and Support Program. We started that in 2013 here at our agency, and so we were one of the first 4 pilot sites in the in the state to start individual placement and support. That has grown tremendously across the state, so we're happy. We were happy to be one of the first agencies to pilot it. So what is individual placement and support? The big thing about IPS is that we view employment as a part of the recovery process. It's an evidence-based process out of Dartmouth, and so that means that we have a program model that's validated by vigorous research. We also have a service guidelines and a fidelity process where we're audited each year to make sure that we are following the evidence-based practice as closely as possible. So there's lots of studies that have been done on this, showing this is a great model for people that have a severe and persistent mental illness. And so we know, benefits for competitive employment for people, it increases their income, it improves their self-esteem, social networks, and just an overall increase in quality of life. We also know that people have a better control of their symptoms and reduce substance abuse once they start working. So, and we work closely with our area employers, helping by giving them some pre-screened applicants and helping to reduce their turnover because we are there to support that person on the job with them. And so supported employment traditionally, it's a mainstream job out in the community. We want someone to be paid at least the minimum wage. That's a big part of this as far as the competitive employment is making sure it's a job that anybody can apply for and not jobs that are set aside for people with disabilities or in a setting where they're only working around other people with disabilities. So, and then with the IPS approach, how it's a little different than the just traditional supported employment, is part of that is that we have 8 principles that we go through with as far as that we follow, and that's one of the biggest things with IPS. One of the things that is that eligibility is based on individual choice. So we have what we call zero exclusion, and really it's that if somebody says they want to work, there's no reason that they should not be referred to us. We want to make sure that there's not ever a time where it's, because they're using substances currently or because they're having mental health symptoms, that they are, said that, well, you need to focus on your treatment first. We really want work to be viewed as a part of their recovery process, and so therefore anybody who expresses an interest in working should be referred to our services. I've talked a little bit about competitive employment. We always want people to be working, whatever their choice is, but pay them at least the minimum wage, if not more. And I'll talk a little bit more about some of our stats for this year, but our average hourly wage for people who were working last year was actually $10.40 an hour. So obviously our people that we are placing are making far above minimum wage, which is awesome. We are also very integrated with our mental health treatment teams. So we go to the staffings with our outpatient clinicians and make sure that the therapists and case managers know where the client is and what's going on, and we collaborate with them as much as possible just to make sure that that person is successful. We also provide personalized benefits planning. So we have a benefits counselor that works through the Benefits to Work program, and we refer people to them if they receive SSI or SSDI so that they know how their benefits may change if they begin working or how they may not change. We also do a rapid job search process. So we really, when somebody says, I want to work, we are getting out there within the first 30 days and beginning to look for jobs for them. And the sixth principle is just about our employment relationships. We have a very methodical process on how we go out and interact with employers and learn more about what their needs are. Of course, we know everywhere across the area is hiring right now, so we try to go out and visit employers to see what their needs are so that we make a good match between them and a potential employee. And we provide continuous follow-along support. So once that person starts working, we are there with them to help make sure everything is going well. You know, if the employer, if there's a need with the employee, you know, something that's not working perfectly, you know, we work with the employer to try to help make the job work out. You know, that's always our goal, is just that our client is happy, the employer is happy, and we're there to provide that support for as long as needed. And also that we really go along with our people's preferences. So individuals choose what kind of job they want to look for. We really don't just push somebody to a particular job just because there's a job opening. You know, we've looked for jobs in IT, we've looked for jobs in the school systems, we've looked for, of course, a lot of the hospitality type jobs. So it's really a pretty wide range of what we're able to do, just because we really just go with whatever that person wants. So Vonda talked a little bit about the programs. You know, we've been doing the traditional IPS, which is our primary program. We've had the Social Security Administration demonstration since 2017, and it is wrapping up in February of 2022 will be our last, and we've really had a lot of success with that program. It was one that was really developed to try to see how providing an employment service to someone who has applied for disability, to see how that would work. As far as helping them to not just go back and get in that process of, you know, apply, denial, you know. So we've had a lot of people work, and all of them are still working. All of the ones who engaged with us are still working, and so we're really happy about that. And then, as she mentioned, we have the Healthy Transitions program. This was the first IPS program where we got to collaborate with CNY for Frontier Health, and so we were really excited that we have that grant in Greene County, and we are able to work with some young adults there. And we also do education with them, so we don't just do employment services. If someone wants to go to college, we are there. You know, we help them with that, applying, sign up for classes, all of those things. So our numbers for this year, we ended up in the IPS program serving 219 individuals throughout the year. We had 106 job placements last year, and we had 55 people to go on and work for more than 90 days. And so we ended up having a job retention rate of 57%, which is really great. And most of our individuals, too, they did not work just part-time. We had an average of 29.3 hours, so almost 30 hours a week was our average. So it's a great program. We've had a lot of success in, especially this past year, which we were all worried about how COVID would affect our employment services, but we found that particularly over the last 8 months or so, we've been needed more than ever, and we've had a great placement rate among our clients. So, Vonda, I will let you take back over.
Okay. Well, does anyone have any questions about our programs? Okay. Well, thank you, Christy, for sharing all the information. By all means, if you do have questions or just curiosities, feel free to shoot us an email. We'll be glad to talk more about it or fulfill your curiosity. And again, thank you for inviting us to speak on employment services. It's a really great time to be an employment specialist because the jobs are everywhere.
Thank you so much, Vonda and Christy. Clearly, I can hear in your all's tone how much joy and effort and the level of seriousness you guys are bringing to your all's project over there, and the level of success is just really beautiful. I know you do a lot of things. I get to watch you guys a little closer, and it's just really beautiful to watch. The lives change, you know. You guys are doing just such great work over there. I do have a question. I'm guessing that these folks, they don't necessarily have to be a Frontier client. They can be anybody in the community kind of referred to you guys, and then it would pick up from there, meaning that there's no real limitations to who gets referred to your program. Kind of a question, Vonda or Christy.
I can answer it. Yeah. The person does not have to be a Frontier Health client. So one of the easiest ways is if someone is interested and is not a Frontier Health client, they can contact their local vocational rehabilitation office and get started that way by going there and letting them know that they're interested in being referred to the Frontier Health Employment Program. We work super closely with VR. Or you can reach out to me or Vonda. We can always, talk with someone to kind of see what the best route is as far as doing that and help kind of guide them through that process.
Thank you so much, Christy. That's great information. Thank you for what you ladies are doing in your teams. That's wonderful. Thank you for presenting today. Okay. Well, let's switch gears and let's talk about any reports that we have coming in from the community. I represent the adult community for Region 1, and I don't have anything to report. CNY committee, Ms. Kayla, do you have anything to report?
I don't have any new news to report. I'm not sure if Melissa has anything that might be noteworthy, though.
No, I don't really either. Just keeping on trucking on, and of course, in the world of kids, school is starting, so it is busy, busy, busy.
Yeah, school does start tomorrow, and I know that Frontier Health has a lot of therapists that are just getting ready to come back full-time because students are coming back full-time in the East Tennessee region. So that's kind of the biggest thing going on right now is just school getting back in session.
All right. Thank you, ladies. And thank you so much for supporting all those kids and families. It's definitely going to be an interesting year with all that's happening around us. The next we have is the Legislative Committee. I also represent that for our region. We want to welcome Miss Lisa LaPolte. She's with NAMI, Tennessee, and she's joined our Region 1 Planning Legislative Committee. We're so glad to have her and her willingness to join us on that, but we're still looking for at least one more person to join that committee. So if you have any ideas, any willingness just to give a little bit of your time and thoughts, you don't have to be. I myself am on that committee. I'm not a lawyer. I don't have any of those I'm a social worker, but I bring all that social work stuff to the table. So whatever your skill set is would absolutely be very needed in that setting. So if anybody has any desire for that, please reach out and we can see about getting you on that committee because we still need one more. Any MCOs present with us today? Okay. Any of the inpatient facilities have anything to report today? Don't think I heard Roger or many of them. Okay. I hope that means that things are well in their world. How about Crisis CSU? Anybody have a report from there?
Hey, Sam, it's Celeste.
Hi, Celeste.
So Christy's out this week, so I'm the Christy for you guys. We are trucking along here in Crisis World, like the rest of the folks, getting ready for school to gear back up. We've been doing some trainings with school-based staff, school counselors, trying to get folks acclimated to some changes here at Turning Point. We have seen a lot more acuity in our crisis consults, and I think that's been, kind of across the board, inpatient as well. We've had, the typical backlog with beds, so just trying to help navigate that. We do have a little bit of decreased capacity here at Turning Point, so trying to maybe filter some folks back out into IOP programs, outpatient services, that sort of thing. We did have a couple of folks this week that were actually sending Vonda's way, so that's a good thing. Trying to just keep our heads above water.
So, Ms. Celeste, do you guys have any new programs or anything that you're ready to talk about over there, or is everything kind of status quo right now?
Everything is status quo right now.
Okay. We'll look forward to anything you guys may have going on in the future. Thank you for all you guys are doing.
Yeah, thank you guys.
Youth Villages, are you with us? How about NAMI? We may have some representatives here. Anybody have anything they want to share with us from NAMI? All right. Any community justice folks? TCCY? ADRC? What about TSPN? TDMHSAS? How about disability rights? Anybody here from there?
Hi, this is Becky Allen with Disability Rights. I just had a couple of things to share. For starters, I just want to kind of piggyback on the information that you heard from Frontier Health regarding the IPS program and support employment services. Disability Rights Tennessee also administers the Client Assistance Program, and that program is also known as CAP. And the purpose of CAP is to assist individuals who are VR clients who may be experiencing any kind of difficulties in accessing VR services, or if they have concerns about the services that they feel like they should be receiving and they're not receiving, any kind of thing like that, where individuals feel like they need help accessing their VR services and receiving appropriate services. That is something that we can help with. And that is one of the program areas that I work in. The ones of us who work in this area, both of us advocates across the state, have been doing this anywhere from 10 to 20 years. So we're very familiar with VR and the federal regulations and the VR state policy. So we just wanted to make sure and get that out there, that everyone knows that there is that service that we provide. If you have any customers, clients you're working with who need assistance in relation to working with vocational rehabilitation. One other thing that I just wanted to provide kind of an update about of something that's going on with us at DRT is that one thing we have been working on recently, actually for a while now, but more recently have had been in talks with the State Department of Mental Health and Substance Abuse Services with the administrative level in regards to the importance of providing culturally and linguistically appropriate supports, or also known as CLAS services, CLAS services. This could relate to individuals who may be deaf and utilize American Sign Language for communication. It could be individuals who are Spanish speakers and do not utilize English or very limited English. So a wide range of looking at all of that. So we've had discussions with the commissioner, as well as with other administrative staff and some of their legal team, just trying to put some things together from the department that we're seeking the support and the input and the commitment, hopefully, of the department to assist in making sure that those services are provided at some point, hopefully soon, across the state, just to be sure that individuals are receiving the supports they need in the language that they need in order to show improvement and benefit from the services. So I just wanted to throw that out there. If anyone has any questions about any of that, they could certainly reach out to us. But again, that's just fairly new in terms of conversations with the Department of Mental Health and Substance Abuse Services. So we're just really kind of in the early stages of working on that.
Thank you so much, Becky, for sharing that. I'm glad you're with us.
Thank you.
Are there any other providers or anyone else that has anything to share today? Okay. Anything from the department?
Hi, Sam. So I realized I think you might have the draft agenda that we had to update last minute because Zach Blair is supposed to go over the 2021 legislative summary. But what we could do is I can kind of segue into that. So Zach, you'll be right after me. All right, just a few updates on my end. Hold on one second, let me pull this up. So I will be sending out an email about this shortly. Just want to put this on your radar though. The joint annual report is coming up very soon. I can't believe it. And this is your opportunity as a region to identify your key accomplishments achieved and challenges faced from July 1, 2020 through June 30th, 2021, and your region's future plans. Each year, a joint annual report is produced and delivered to the governor and state legislature to highlight accomplishments, challenges, and plans for the future. The joint annual report is a collaborative effort between our department, the regional councils, and the statewide council. This information is due to me by close of business September 17th. It can be sent via email, but it's a really great opportunity to highlight what you're all doing in Region 1. I know you're doing so much there. So if you have anything you want listed, get with Sam or Tim or Kayla, and they'll put together a document to send to me to include into that report. Year 3, FY22 of the 3-year plan is in progress. Regional councils will have an opportunity to review within the coming weeks. Development of the FY22 mental health block grant is also underway. Statewide and regional councils will have an opportunity to review that as well. The 2021 legislative summary is complete and has been posted to the department website. I have a link included in my minutes, in my department update, which I'll send to Kayla to include in the minutes so you can access that summary. When Zach presents, he will share the document with you all to see, but it is available on the department website. And last but not least, the department is releasing a new certification for peer support specialists designed specifically for young adults with lived experience of mental health and/or substance use challenges. The Certified Young Adult Peer Support Specialist program is tailored to young adults in both design and language with a target age range of 18 to 30 and a requirement of 1 year in recovery. The program includes a 1-week, 40-hour training session covering topics including responsibilities and expectations, strategic sharing, youth empowerment, positive youth development, the ladder of youth voice, and trauma-informed care. Through this training, specialists will gain the knowledge needed to provide youth and young adult-friendly peer support services to individuals under the age of 30. Peers certified through the program are also required to complete service hours and continuing education to maintain their certification. This program joins the department's current offerings in peer certification, the Certified Peer Recovery Specialist and the Certified Family Support Specialist. I also have a link included here where you can gain more information about this program on the department website. And that's what I have for my department report.
Thank you, Kirby. Zach, are you available and ready?
I am here. Good morning, everyone. Hope everyone's doing well today and enjoying their day in the Eastern time zone. The first thing that I would like to say is I have a 70-pound four-legged doorbell here, and he likes to interject himself into conference calls. So if the dog starts barking, I hope you'll excuse me. I'll try to settle him down so we can keep going. The next thing I'd like to do is introduce Kristen Veloff, who is our new Assistant Director of Legislation and Rules. After several years of needing it, we have finally got a second full-time person on our team and the office that I work in, and really excited to have her. Kristen and I worked for a few years together at the Department of Children's Services on the legislative team there, and Kristen's been with the Tennessee Board of Regents for the last few years as the Assistant Vice Chancellor for Government Relations for TBR. Kristen's also a proud ETSU graduate and has her master's degree from ETSU. So last week we had Region 7 in Memphis. Kristen's from Memphis, and now we have another local connection as a graduate from ETSU. So like to introduce Kristen to you. Kristen, feel free to say hi and tell everybody about yourself.
Good morning, and I'm so excited to be here, and thank you for that introduction, Zach. And I'm just excited to get to work for the department and get to work with each of you. I look forward to the amazing work that we're going to be doing together. And please let me know if there's anything I can do for you. I'm just happy to help in any way I can.
Thank you, Kristen. And like I said, we're real excited to have her on the team and have some more support in our office as the attention on mental health and substance use disorder continues to grow in the state. I am going to share my screen real quick and put up the legislative summary. Kristen, as usual, I have your face in the corner, so if you'll nod for me if you see it, and you do. I'm just going to touch on some highlights here. Not going to go through every bill, or we would be here a lot longer than I think most folks would be interested in being here. But I'll touch on some highlights, and if you have any questions or if you've reviewed previously and have bills that you'd like to discuss, please let me know. The very first piece of legislation on this list is House Joint Resolution 175. This was a memorializing resolution for Ellen Abbott, and I know many of you are probably familiar with Ellen and the work that she did as our Director of Criminal Justice Programs with the department. We lost her early in 2021, and she made a huge difference and advocated for that population in a significant way. And we certainly miss her, and we're very proud to see the legislature honor her with a joint resolution. So we thought it was very fitting that that be included on our summary and that it be the very first item that we include. So encourage you to take a look at that, read the text, learn more about Ellen, and you'll see just how much we miss having her as part of our department and part of the folks that serve the state of Tennessee and specifically the criminal justice population here in the state of Tennessee. Moving down, Senate Bill 753, House Bill 81. This was a bill that our department actually proposed and was included in the governor's administration bill package for the 2021 session. Most of the things on the list don't pertain to the councils as much, but there is a section that we had discussed previously that has now gone into law that codifies the membership structure for the regional councils. In the Tennessee Code Annotated, the statewide council is enumerated with membership requirements and the regional councils were not. And there was some confusion, especially during audit processes, about whether the membership structure for the statewide the statewide council went down to the regional councils. So this just makes sure that the intent of having former service recipients, current service recipients, and family members of service recipients is still seen on the local level, but doesn't have the same requirement that the statewide council has, since those appointments on the regional level are really locally governed and locally controlled. So I wanted to make sure that our regional councils are striving to do that, but the requirement is a little different. And then the second portion of the bill that I think individuals on this call would be interested in, there was some confusion with licensed alcohol and drug abuse counselors, and specifically the board that licenses that profession, on whether they could provide telehealth and telemedicine services under the new legislation that was passed during the 2020 extraordinary session. And there was some confusion in the statute, but this bill just makes it very, very clear that licensed alcohol and drug abuse counselors are authorized to provide telehealth and telemedicine services under state law. So we were glad to try to help with that clarification and make sure that that profession knew that they had the ability to be able to do that work in a virtual way. Moving on to page 2, the very last bill, Senate Bill 739, House Bill 73. This particular piece of legislation got a lot of attention, so you may have heard of it, but this is the K-12 Mental Health Trust Fund bill. The bill establishes the accounts for funding that were included in the governor's proposed budget and the finally passed budget for fiscal year 2022 and ongoing after July 1 of this year. So the bill itself structures the accounts that will be used, but as part of the budget, the governor set aside $250 million, and the legislature approved this idea of creating a mental health trust fund. 225 makes up the corpus of the trust that's allowed to grow on an annual basis, and there is another account that allows for expenditures under this particular program to support prevention, intervention, and other programming for K-12 students who have mental health needs. So it was a very creative way to use non-recurring funding that we had an abundance of to try to generate some recurring funding for particular services, specifically K-12 mental health services. So we were very, very excited about the legislature and the governor's commitment to providing services there, and very excited about the very large investment that will fund services for a number of years based on the growth of that account. Moving on to page 4, Senate Bill 207, House Bill 215. This bill was a fairly comprehensive and large bill regarding recovery residences and some consumer protection when it comes to certain treatment resources. The biggest thing for folks on this call is if you are in the recovery housing arena or provide that, this does require that recovery residences look at becoming certified under a credentialing organization of some sort. And it does restrict referrals to recovery residences based on membership of that recovery residence in an organization that provides standards for those. So really encourage you, again, if you are in the recovery residence arena, please take a look at that bill and work with your folks to make sure that you are looking at those requirements that are under this particular piece of legislation. Senate Bill 558, House Bill 1132 creates the Tennessee Opioid Abatement Act. This bill creates an opioid abatement council, which will be responsible for distributing money from the opioid lawsuit settlements that are in negotiation. Still waiting to get further details on the amount of money Tennessee will receive under those settlements. And there are various entities that have to make appointments to this particular council. and still waiting for all that to come together. But the abatement council itself will be an independent board and council that will have decision-making authority. However, it will be administratively attached to our department for the purpose of HR, financial, and management of those functions. Where if that wasn't the case, they would have to have staff to be able to perform all of those duties. So it will be administratively attached to the department, but will be an independent council on distributing the funding from the opioid lawsuit settlements. Last bill on this page, Senate Bill 118, House Bill 490 creates the Medical Cannabis Commission. It did not legalize medical cannabis specifically, but requires that commission to come back to the legislature to basically provide a plan for medical cannabis in the event the federal government reschedules marijuana at the DEA level. It also did increase the limit to 0.9 THC for certain cannabidiol substances if someone has a health condition and certain other requirements are met, like a doctor's approval and the demonstration that other treatments have been unsuccessful. So that's a bill as marijuana discussions continue to pop up and legislation around that continues. This is probably the first major action by the legislature to begin preparing for that situation if marijuana were to be rescheduled at the federal level. On the top of this page, page 5, Senate Bill 1265, House Bill 508. This bill authorizes unlicensed graduates and students in medical training programs to be able to provide telehealth services so that they can get their hours and meet their clinical requirements via telehealth if that's needed. We found in a lot of circumstances that students in these programs in a lot of areas around the state weren't able to get their clinical hours because they weren't able to access the facility. And so the legislature gave authorization for those students under the supervision of a licensed provider to be able to get their clinical hours via telehealth and telemedicine services. Moving on to page 8. The top two bills here are sunset bills, and as many of you know, and if those are on the call that aren't aware, each department entity and each agency of state government has to go through a review process periodically. And it was our turn on the calendar, and we were very grateful that both the department and the statewide planning and policy council were extended under state law until June 30th of 2025. So we will be able to continue to exist and operate, and we'll continue to do our work and then come up for review again in 2024. The last bill on this page, Senate Bill 773, House Bill 779. This was a bill that departments who had some ongoing COVID related needs and to capture some provisions of executive orders that we saw during the 2020 and 2021 year. This bill mostly pertains to the Department of Labor, but there is one provision related to transportation under the piece of legislation that pertains to us. And it just allows a transportation agent to get an electronic copy of a certificate of need when they're transporting that patient to a psychiatric hospital. And the reason why this is important, a lot of evaluations for certificates of need were being done via telehealth, via teleaudio, and sometimes a paper copy wasn't generated. So this just allows an identical electronic copy to be accepted in place of the hard copy that was required under state law. On page 10 here, I will give a little caveat and tell folks I am not at all an expert in criminal justice. There are a few people at our department that are, but unfortunately, I'm not one of them. But Senate Bill 767, House Bill 784, Senate Bill 768, and House Bill 785 are the two large criminal justice reform bills that passed. These were bills that the administration and the governor's office really worked hard on to get passed this year, and were major initiatives from Governor Lee to undertake criminal justice reform during the session. The first bill relates to community-based alternatives for incarceration. So there's a lot of information there related to community-based alternatives, and then rewrite some provisions on community corrections and probation, supervision, release on bail, things of that nature, to make sure that data is consistent across the state. Then the second bill is really about reentry and making changes to provisions that incarcerated individuals who are going to be released soon or who are being released in the near future, planning for those populations. So again, if you're in the criminal justice world, certainly would recommend taking a review of those two pieces of legislation. And then that should be the last bill that I have highlighted, but obviously certainly happy to answer any questions about any other pieces of legislation you might have seen on here, or anything that I didn't cover when I was going through this. Happy to answer those questions now if you have any. All right, well, I will assume silence prevails, and thank y'all for your time today, and feel free to email myself or Kristen if you have any questions. We look forward to being helpful with that and working with you moving forward.
Thank you so much, Zach, for sharing that. Thank you so much for the advocacy and all the efforts. Clearly, there's a lot of work there, and I know that that comes from so many hands and so many brains, and we're just so appreciative of all that effort. Is there anything else that needs to be shared? Anybody have anything at all today? Okay. Kirby, am I missing anything before I take a motion?
Nope.
All right. Can I have a motion to adjourn? Anybody?
This is Becky Allen. I will move to adjourn.
Thank you, Becky. Can I get a second, please?
This is Kayla. I'll second.
Kayla Withrow, thank you so much. As Kirby said, our plan is our next meeting will be Tuesday, November the 9th, 10 a.m. We will advise everyone as what the modality of that meeting will be. I won't say what my expectations are. We'll just see how this rides. Thank you guys so much. We'll look forward to Tuesday, November the 9th. Thank you so much for everyone's time and being available today. And hope to see you next time. Have a great week, guys. Thank you.
Bye, everyone.